morning, good afternoon, and good evening, everyone. Welcome back to our YouTube channel on patient safety. My name is Julian Nachiaga, and I'm glad to be at Lira Regional Referral Hospital once again. And here with me, I have the QI focal person for the region and the QI focal person for the hospital. I would request them to introduce themselves before we start this session.
Okay, good afternoon. My name is Miriam Natukunda. I work as the Quality Improvement Officer for Lira Regional Referral Hospital. Thank you.
Good afternoon to everyone. My name is Laban Habokwesiga. I'm the Regional Quality Improvement Officer supporting Lira Health Region, and I sit at Lira Regional Referral Hospital.
Thank you very much. I would request each of them to tell us briefly how the QI activities are being rolled out within the region for the regional focal person, and also then for the hospital, how are they carrying out the QI activities at the hospital to ensure that they are sustained. So
to begin with, I will give highlights of how we are doing quality improvement at the hospital. We have a team, what I can call the quality improvement team for the hospital, that has around 34 members and representing each of the different departments and units that are here at the hospital. It is a team comprised of doctors and nurses, consultants, and of course with the leadership from our administration, and that is the director who takes the chairpersonship of our team. We have monthly meetings which we usually do to help identify and tackle these areas, especially to do with patient safety, and furthermore we have projects that we are running as a hospital. I'll basically talk about the maternal issues since they have been rising up very much. For example, in maternity, we have a project running about decision to incision time being reduced so that our mothers get an on-time incision, which reduces the burden of death. We have the MPDSR reports and reviews that are being also done to identify exactly where the cause of death is coming from, and this is a very good area for quality to make sure that our patients are safe. We have got interventions of IPC, infection prevention and control, and this cuts across, looks at things like hand hygiene, which are very primary to patient safety, and also moves along with the issues of antimicrobial resistance to make sure that this is combated, and at the end of the day it comes out back to our patients being safe. Furthermore, we also make sure that our patients get to know of their rights, which helps them to seek the medical, to seek the healthcare services appropriately when someone knows what they're actually entitled to. And this brings us to doing a survey of satisfaction to see if our clients are really satisfied of what we are administering to them, and this also helps us on our side to assess and to see if we are doing the right thing, especially in issues to do with patient safety. We have internal user trainers. These train our staffs on use of equipment, and these equipment, some of them are donations, some of them are new, and it needs a continuous teaching to the staff and to the new members who come on board, especially with the healthcare workers, to make sure that they are all well versed with the equipment, because at the end of the day, if an equipment is not used in the right manner, it could affect the patient safety. Thank you.
Thank you very much. Yes, to the regional QI.
Thank you very much. I will start with the National Quality Improvement Framework and Strategic Plan 2021-2025, which is a Ministry Health guideline that is guiding the implementation of QI activities across regions. In that framework, they have designed structures how QI functionalities is supposed to be. And as a region, we have embraced the framework. Currently, I will start at regional level. We have a regional quality improvement committee that is chaired by the hospital director, Lira Regional Referral Hospital. In that committee, we have different DHOs across districts within the region, together with quality improvement focal persons at district levels, and also involving the quality improvement officer at regional referral hospital. In that committee, we are holding meetings at a quarterly basis, and what comes in those meetings, we see the quality improvement focal persons of different districts share the quality improvement activities and the work they are doing across the districts, and also rolling down to health facilities. We have also subcommittees in different areas. For example, we have the voluntary male medical circumcision committee. This is aiming at looking at advanced events that affects clients when they undergo circumcision. And the committee does audits to audit for every occurrence that occurs and group it according to the criteria, and then they are able to manage these advanced events, also involving the community structures, since they are the one who are in the community and can easily identify. So we have that mechanism where the communities can link up to the health facilities to report those advanced events to address patient safety issues. Similarly, we have also established the district quality improvement committees at every district, and districts are able to meet at a quarterly basis to discuss about quality improvement initiatives within their districts, down to scoring from the facility levels. They call these meetings, and some of the members in these meetings are the district health teams, and also involving the in-charges of facilities, so that gaps that are being identified at facility levels are able to be discussed at district level, and then they discuss solutions to address those issues, to address patient issues, and also improve quality. Similarly, as a regional referral hospital, they conduct quarterly meetings, and during the regional quality improvement meetings, the hospital is able to provide a report discussing all the quality improvement initiatives they have been doing at the regional referral hospital, how they have involved the worker improvement teams at unit levels to address some of the key program areas to improve quality of services to benefit the clients. We aim at ensuring that a client is put at the center, and we aim to ensure that we minimize harm. For example, at regional levels, we are also conducting regional performance reviews focusing on maternal, perinatal death surveillance reviews, whereby facilities are able to account for each perinatal or maternal deaths that are occurring within the facilities, and then the committee looks at those gaps and also discuss measures to address those gaps, so that they avoid the recurrence of the same causes. Basically, that's what we can say about that. But maybe to add just on one point is that as a region, we are also doing support supervision focusing on QI, and also we are also doing mentorships and coaching using QI approach to improve all the key program areas, for example, in maternal, neonatal health, and also HIV/AIDS and TB. We are using quality improvement approaches to do coaching and mentorship to enable staff at facilities acquire skills to be able to manage certain conditions and improve service delivery. Thank you very much.
Thank you very much. And to conclude this session, I would like to ask how frequent do you do the client satisfaction survey for your clients, and how frequent do you do the assessments you say for the hospitals?
Thank you very much. I will start with the assessments for the hospitals. We are doing assessments on a quarterly basis, looking at 5S, which is addressing the issue of patient safety. So every quarter we do the assessment, and we are able to disseminate the results or the findings to the rest of the staff and other stakeholders, so that we can minimize on some of the gaps we identify to be able to address that. For client satisfaction, we do this one quarterly, so sometimes it involves some costs, and also you realize that it is a big interview that you conduct. So we have tried to do that. For example, we have had one client satisfaction survey, and during the Regional Quality Improvement Committee meetings, we have had a presentation of the findings. The Minister of Health has supported us into also conducting those surveys across the region, and we are able to compare our performance with other regions and also learn some of the best practices from other regions to more improve our services for our clients.
Thank you very much. Is that the same as for
Yes,
you here?
yes.
That's okay. Thank you very much, everyone, and thank you, Sister Miriam and also Mr. Laban, for this session. And we'll be back to Lira Hospital to also learn of the how you approach these different results from the surveys and assessments, and also how you're doing with the user trainers that you carry out.